Welcome to Sydney Animal Hospitals. I'm Dr. Ben Brown. Today I want to talk to you about lumps and bumps in pets and why skin cancers are important, just like in humans. You're probably aware of how important it is to get your own skin checked for skin cancers, but what about your pet? Have you noticed any strange lumps or bumps? Any discolorations or thickenings of the skin? It's important to have these checked as well. Pets can suffer from sun-induced skin cancer just like we can, due to lumps that grow either within the skin or beneath the skin's surface. It's important to have any lump checked thoroughly by a veterinarian. Today I'll show you how we do that. Here we have Anushka. She's a 12-year-old Hungarian Vizsla and she's here for her free lump check today. So lumps can be benign or malignant. Malignant lumps mean cancerous lumps. Sometimes we can tell by looking at a lump whether we feel it's more or less likely to be benign or malignant, but more often than not we need to do tests to send off to the lab or to look at here at the practice to determine if a lump is going to be cancerous or not. I'm going to show you today how we do a lump checkup on our wonderful patient here, Anushka, and we're going to show you some examples of some lumps that look a little bit suspicious that might be malignant and some lumps that look a little bit more likely to be benign. So to do a lump check, we feel over the dog's entire skin, looking for any irregularities or bumps. But sometimes lumps don't always feel like a raised part of skin or a raised piece of tissue. It might simply be just a discoloration of normal skin that might cause us to be concerned. First of all, we check the head and we can see little lumps like this near the eyes. If they're slow growing and not causing an issue to the dog, sometimes we choose to monitor those. Sometimes if those lumps are actually on the eyelid, they can rub on the eyeball, and even though they might be benign, that still warrants removal because they cause issues with quality of life. Sometimes dogs can get lumps because they like to lie in the sun. It's particularly important to check areas where there isn't any fur, like underneath the arms and in between the back legs, because that's where dogs can actually get skin cancers. So here we have a lump on the non-haired area of skin on Anushka's belly. This area is often exposed to sun. This particular dog loves to sunbake. We're a little bit more concerned about this lump. You can see that it's quite red. There's a lot of evidence of blood clotting and bleeding underneath the skin. It's very irregular in terms of the margins. It's very hard to feel where the lump starts and ends. And this lump has appeared suddenly. It's also been bothering the dog. You can see that she's been looking at this lump. So this is something that we really need to get tested. This lump has some of the features we would expect with a malignancy. And you can see there's a lump here, has been on Anushka's skin for many, many years. But just recently, the skin surface has become a little bit more red. This lump is very mobile and it's sitting just underneath the skin, so it's subdermal or subcutaneous. This lump is more than likely a lipoma. I'm going to show you how we test to confirm this here at the practice so that we can be sure that we're not missing something that could be malignant, because we can't always rely on how a lump looks or feels. These are just soft indicators that might help us get a bit of an idea as to whether we need to be worried or not. So to check if a lump is benign or malignant, often we'll do a test called a fine needle aspirate. A fine needle aspirate involves inserting a small, very fine needle into the lump and harvesting some cells from the lump by applying small amounts of pressure to the needle to get small amounts of cells out of the lump. Firstly, we need to disinfect the skin with alcohol so that we don't introduce any infection. After the lump has been cleaned, we then need to stick a very small needle into the lump to harvest some of the cells in the lump. We do this very carefully, making sure that we get an adequate sample from a variety of locations inside the lump. Sometimes there can be a little bit of bleeding. This is normal. Once the sample's been collected, we spray the sample onto a microscope slide so that the cells can be checked underneath the microscope. It's important to note that this procedure is not overly painful for your pet. It's the same kind of needle that we use for routine vaccinations and blood samples. Most dogs tolerate this procedure without any need for any sedation, and often will do it with the owners present. So today we've given you a bit of information why it's important to get your dogs checked for any lumps or skin cancers. We've shown you how we conduct a fine needle aspirate, which is a painless procedure for your pet, but can often deliver life-saving information. The other thing I wanted to let you know is that during October and November, we're doing free lump checks and free skin cancer checks at Sydney Animal Hospitals. We're your local vet. We're open every day of the year except Christmas Day, including weekends and public holidays. So I'd encourage you, if you've noticed anything that you're not sure about on your pet's skin, or any lumps or bumps that have suddenly come up, come down and get them checked out free of charge.